Hi, I'm Terry, and I'm going to do your preoperative conference by video. And one of the things that you will have already received is a packet in the mail, or maybe you stopped by to pick up your pre-op packet. And one of the things that is going to be inside is some consent forms that you are going to initial, sign, date, and mail back to us, along with this form right here, and it is exactly what I'm going to go over line by line, and Dr. Eds would like you to initial each thing that I say. After I've said it, if there's something you don't understand, just leave it blank, and then absolutely call the office and someone is going to answer your questions. But at the end, when you mail your consent forms back, you will also sign and date this and send it with your consent forms. Inside your packet, the first thing you're going to see is a cover sheet. It's just going to state the date of your surgery and what time to be here. He does start his surgeries in the morning, so some people are here at 7, some 8:30, but it will be specific and highlighted in yellow inside your packet, so you'll know exactly what time to be here. And you do come to this office where you had your consult with Dr. Eds. In his video, you got a short tour of the operating room, and it is here at this building, so this is where you come. One thing we like to mention, that if you do have an issue with sleep apnea and you have a CPAP machine, do bring it the day of surgery. Probably won't even touch it, but we do like you to have it just in case we need it in recovery. And you may say, well, I haven't had one or used it for years. If you have one, we want you to bring it. Allergies and sensitivities, that should already have been discussed when you had your consult with Dr. Eds, but sometimes people don't think about allergies such as, or not so much allergies, but sensitivities such as nausea with certain medications. That's important because what we order, we sure don't want it to cause an issue if you already know that. So make sure that we know every detail of anything that might cause an issue with you. Some people have an issue with latex. We need to know that. And then the medications that you take, there was an area where you listed those on your encounter sheet, but things that maybe you didn't think was important, everything you take is important. It might be an over-the-counter medication, an herbal supplement. Those are important for us to know. Such as maybe you're taking something for weight loss. It could be prescription or over-the-counter. Or you take something for ADD, ADHD. Anesthesia wants you off of those medications 30 days before surgery. That's important. It has to do with your blood pressure and heart rate. The other thing is things you might take, such as a fish oil. You might not think that's a big deal, but in your packet it tells you week before, week after your surgery, stay away from aspirins, ibuprofens, herbal supplements, the fish oils, evening primrose oil, herbal supplements, anything like that. You need to be off of that. Inside the packet, you are given an almost 4-page list of medications to avoid if you do have any questions. If you haven't already notified the office or let someone know, we do need to know what pharmacy that you use, along with the zip code. Address is important, but zip code is where we will find your specific pharmacy. And what we do, a week before or several weeks before, they may go ahead and send in your prescription for antibiotic, which you will start the day before surgery. You're also going to get a prescription for Zofran, that is for nausea, and you may not need it, but if you need it, you'll appreciate that you've got it in your hand. Day of surgery, that's when they send in your pain medication and muscle relaxer if you have breast augmentation. Now, what's important is that we know exactly what pharmacy you're using, and it is going to be sent electronic. So sometimes a pharmacy you may call and they say they don't have it. Just let them know it was sent electronic, and that usually takes care of it. When you are taking the pain medication, any of that type medication for pain can cause constipation. It just slows your system down. He wants you to have an over-the-counter stool softener ready to go. It can be generic from your pharmacy or Walmart. The main thing is you start it when you start taking the pain medicine, but always follow box directions. They like you to call the office the day before surgery just to confirm your time to be here. If you forget, we're not canceling surgery, but they just like to touch base with you. If your surgery is on a Monday, then just call in anytime on Thursday just to give them a heads up. HibaCleanse soap. You have a shopping list in your packet, and HibaCleanse is listed as one of the items for you to pick up. HibaCleanse is an antibacterial liquid soap. You can get that at your pharmacies. If you happen to be at Walmart, I see it usually where the alcohol peroxide is located, 6-ounce blue-green bottle. And what he wants you to do, the night before your surgery, the morning of your surgery, from your chin to your belly button, with the loofah, you just suds up all over, around, under your breast. Rinse off, dry off. After you've done that, nothing on your skin. No moisturizers, lotions, powders, nothing. Because you're having breast surgery, morning of surgery, after you've rinsed off and dried off, take about a quarter size or so of the HibaCleanse and you just smear it all over, around, under your breast and let it dry. It is splotchy and sticky until it dries, but then you won't notice it. Also, the morning of surgery, it is fine to use a little bit of deodorant. You do not want to eat or drink after midnight, night before surgery. Morning of surgery, still not eating or drinking, but it is okay to brush your teeth, rinse your mouth out. Do not wear any makeup, no false eyelashes, acrylic nails. If you do wear acrylics, gels of any type, your pointer finger of each hand needs to be the natural nail bed, and then toenail polish doesn't matter. Contacts, do not wear those morning of surgery, but if you need lenses, your glasses are fine to wear. Clothing, it'll tell you in your packet, nothing pullover. The easiest thing for you to wear in and to get on to wear home is just an oversized button-up or zip-up. Also in your packet, you have an order to get your labs done. It'll be a CBC and a complete metabolic profile. The main thing about this is you need to do it 2 to 3 weeks at least before your surgery. Your lab results are good for a 6-week period, but it is important not to wait too close to surgery to do that because we need the results on your chart. They are not fasting labs, and when you call to have your lab work done, you need to do that because there's a code that we are required to put on your order form or they won't draw your blood work. And that code is cosmetic, so that means your insurance will kick it out. So just call around with your local labs and just tell them what you need, and it's listed, and what do they charge out of pocket for a CBC, complete metabolic profile. And that'll let you know if you need to call somewhere else. And I'm going to give you a reference. There's a lab close to us, about a mile down the street from Dr. Ed's office. They charge out of pocket for a CBC metabolic profile $35. So that is a reference for you. And some people drive over and get their order and go on down the street. They are open 7 days a week, and we can send you a form that gives you their hours if you choose to do that. Mammogram, he starts mammograms at age 40, unless there's an issue to do it sooner. We just want the report that it can be faxed over. It is good, your mammogram is good for your current year. So if your surgery is today and your mammogram you had 8 months ago, it's still good. As long as it's in your current year, we just want the report. No films, no CDs. And if you do need a mammogram, it's better for your provider to order that because, again, we have to put the code, and the code is cosmetic. Same thing goes for an EKG. If you're age 60 or certain medical conditions, certain medications that you're on, you'll need an EKG with interpretation. it's best if your provider will order that. If not, you can call in and we can give you some guidelines of what to do. Sometimes he will ask for a medical clearance. We will have a form that is filled out that you take to your provider. It could be, for instance, cardiology. You would take it to your cardiologist, ask them they can sign it, fax it back to us, and a lot of times the cardiologist will do their own dictation and they'll just fax over their notes, which is fine. But if you do need a cardiac clearance or any kind of clearance, it's best to get on that. And Dr. Ed's is good for the clearance for a 3-month period, so I'll make you aware of that. Anesthesia, your surgery will be done under general anesthesia, and our anesthesia provider has been with Dr. Ed's for many years, and he's excellent. The morning of surgery, he'll come in, ask you questions, you'll have time to ask him questions, and I think you'll feel real comfortable with him. Transportation. Whoever is with you day of surgery, they're welcome to stay here in the office while you're here. You're here usually about half of the day for breast augmentation. If you're having a mastopexy lift, well, that's a lot longer surgery. So if they want to come and go get something to eat, that's fine. But if they are out of the office, when you get to recovery, they will be notified, and that gives them 45 minutes to an hour to get back over to the office to pick you up. Breast augmentation alone, you are not required to come back the next day. So usually it's a 1-week follow-up. If you need Dr. Ed's, of course, he's available. If you're having a lift, mastopexy, he does see you the next day, so you are required to come back for that. Activity, up, moving, walking, that's important with any surgery. You're not doing power walks, power treadmills, but you're just up moving around the house, taking it easy, but not laying in bed all the time. That's not a good thing. As a matter of fact, that can cause critical issues. So up, moving to the bathroom, walking to the kitchen, living room, just up, moving around. Position that you sleep in, I think you are better served if your head is 30, 40 degrees above your heart. So think about a recliner. If you're in bed, a couple of pillows. And one of the reasons is it's just the pressure from your surgery. In the operating room, Dr. Ed's will do a nerve block. You're completely asleep. You'll never be aware of it. But when you wake up in recovery, you're not in pain, but you'll feel a pressure. Sometimes they'll say, what is sitting on my chest? And a good way to think about this is, for a pregnancy, you know that tummy stretches over 9 months. With breast augmentation, you're stretching over 60 minutes. So that's tight. And that's why you feel that pressure, and I think gravity just helps if your head's up a little bit. But the main thing is to sleep however you're comfortable. Ice packs for breast augmentation, he is fine for you to use the ice packs just in a Ziploc bag. Put a cloth and just lay that on your chest. You just do not put ice directly on skin. Driving, it says a week in your packet. The main thing is to be off the pain medicine. It's completely out of your system. You're not fuzzy-headed. You've got good use of your arms, and he's okay with that. Taking a shower, you are fine to take a shower the next day, and I'll go into that just in a little bit more detail in a few minutes. Infection, what do you look for? Pus-like drainage, temperatures going up, hot to touch, red streaks, anything like that, you call. We don't see that often, but that's just what that looks like. Night of surgery, if you run that low-grade temperature, 99.8, that is not infection. You're just dehydrated and you need to increase your fluid intake. Sun exposure. It takes up to 1 year for a scar to fully mature. So during that time, if you went to a tanning bed, you go to the beach, you're laying out at the pool, and I mean reclined back, even with a bathing suit top, you want to take a Band-Aid and physically cover your scar. Some clothing, even though it may say 70 proof, from the UVB rays, you want to make sure nothing can touch that scar. If it does, it can plump it up like a little cord or discolor it. So you just want to be real careful with that. If you're just setting up under the canopy, upright, well, it's not a big deal, but I'm talking about if you're reclined back, getting that sunshine. That's when you need to do that. As far as your sutures, they dissolve, but he will put a little clear film right over the incision itself. He uses it as a skin protectant or a skin barrier. And that'll start to peel up usually about 2.5 to 3 weeks after surgery. When it does, just take some tweezers and you just get the edge of it and you just gently peel it side to side. It'll go in the exact direction of your incision, so it'll go horizontal. And then after that, I still would use a light day panty liner inside the bra. It's just a nice cushion from that rubbing. Don't get anything with a perfume or a scent. It just needs to be just straight panty liner. As far as your bra, in your packet you should have a form, and it's from ClearPoint Medical, and it will be highlighted on what to order. There's a toll-free number. For breast augmentation and even with the lift, the style number is 218. You will call. And I always say don't wait too close to surgery to call, because the shipping would be more than the bras and it's not worth it. If your surgery is scheduled quickly and you don't have time, just you can go out yourself and get just a soft support, no underwire. But if you do have time, ClearPoint it's good because they'll send you 2 bras in a package. Right now it's $32, and your shipping should be about $7 or $8. When ordering the bras, they're not going to ask you cup size, they just want to know your band. So if you normally wear a 34, just go up 1 size, go to a 36. If you're normally a 36, just get 38. Color-wise, we like you to get white or beige, and the only reason for that is sometimes, especially with the lift, they will make a little mark on the bra, and that way you can see it. Bring your bra with you day of surgery. That is part of your dressing. So what will happen in recovery, you'll have a little gauze with a piece of tape, then they're going to put your bra on, and then Dr. Ed supplies you with a strap. It goes on the low part of your back. It comes up under your arms and it velcros on the top part of your bra. It's very important for that strap to be on the lower back. And it's just like with your bra, it moves during the day, so it may have to be adjusted. But they will pin your strap to the bra. And the next day after surgery, as I said before, you can get in the shower. So you just take the strap, the bra off, that little gauze piece of tape off, get in the shower. It's fine to wash your hair, soap and water running down over your incision. That film, don't rub on it, but it's fine for the soap and water to run over it. When you get out of the shower, just take a dry cloth, you just pat dry, and then take a sterile non-stick gauze or pad, it's on your shopping list. You place that right there, put your bra and your strap back on. 24/7 that first week. Wear the bra, wear the strap, unless you're in the shower. And then at your 1 week follow-up, you may get out of that strap, you may not. It all just depends on how the implants are riding, but Dr. Eds will address that at your 1 week appointment. As far as going back to work, if you work a job outside the home, if it happens to be more of a desk-type job, administrative job, a lot of women go back within the week. Usually it's right around day 4. If you're feeling like it, off the pain medicine, not fuzzy-headed, then he's fine with that. If you have a job that's more strenuous, and a lot of women do, then discuss it with him or call and just make sure. But it may be a full week or it could be 2 weeks after surgery, but just make sure you ask about that, depending on what your job is. If you work from home, maybe you're a stay-at-home mom, well, you still work, but the advantage is maybe you can just take breaks, whenever you feel like you need to sit down. I wanted to talk about collection. I think he's mentioned that in his video with your consultation, but I just like to go over it just briefly. Let's say you're out from surgery a day or 2. You went to bed last night, everything's fine, but you get up this morning, your left breast is swollen up to your collarbone. Well, that could be a muscle spasm, and it'll go right on down. It could be, if it doesn't go down, it could be a collection of blood. It's called a hematoma. It is not an emergency, but he does want to know about it. When you call, if you live, hours away, he'll probably say send a picture, and they'll look at that on the email and just maybe can give you some guidance that way. But sometimes it does require, a visit to the office to make sure. If it is a true collection, you do have to go to the OR to remove it because of your implant. If that occurs, there is zero cost to that. We do not see this often, but if it does happen, number one, I just don't want you to panic. I just want you to call. And number two, that there is no cost to it. And if you do have to go to the OR for that, just remember this. Don't eat or drink after midnight. Make sure someone's with you to drive you home, because he would do it with you sleeping. And if he's not sure, then he may watch it for a few days. But the main thing is just to give him a call. And this is not something that you're going to worry over or stew over looking in the mirror, because your breasts are going to round and shape a little differently anyway, because as you remember, he said they're sisters, not twins. This is something that you're going to look in the mirror and go, whoa, or oh my goodness, it was not like that last night. It's that kind of a difference. Your follow-up, like I said earlier, is usually at 1 week unless you need them. That's for your first one. And on your shopping list, it is checked that you will be on vitamin E and milk thistle. Those are two things that you will start usually at your 1 week follow-up. Don't start them until they tell you, and usually that is at the 1 week visit. Also at that visit, they'll show you how to do breast massage at the same time. Sensation around the nipple area, he just likes me to say that you cannot guarantee that there wouldn't be permanent change in sensation. That is something that I rarely hear about, but could it happen? Yes, and he likes me to mention that to you. What I hear more often, and this can be 3 or 4 months down the road even, stinging, burning sensation. That's just been the stretch on your nerves, normal. You may notice little shooting pain, that's muscle spasm, normal. But by that point, easily ibuprofen is your go-to, and that usually takes care of it. If it doesn't, you just give us a call, and he'll probably have you to come in just to check on it. As far as your bra goes, most people ask how long do you have to wear the bra that you're going to order. My take on that is you've ordered it, and it's not some awful medical looking bra, so if you can deal with it until you're ready to go out and purchase something you like, I think that's the best thing to do. If you hate them and you want to go out and get something different, I just wouldn't sink money into anything expensive while you're rounding and shaping out, because that's not where you're going to end up. Just don't sink a lot of money into that. It usually takes 6 weeks, it could be 8, 9 weeks, just depending on how tight the pocket is or how long it takes you to round and shape out. But when you are finished here with Dr. Ed's, then you can go out and buy whatever you want to. But just remember, you have to be patient with it. And after you're finished here, a good underwire, good under support every day is important. And if you are someone who does a lot of physical activity, exercising, where it causes your breast to bounce up and down, or you may not do exercising at all, you just may ride a riding lawnmower. Well, that's going to cause bouncing. You want to get a good jog bra. And the way you know the best thing to get is if you put it on, you jump up and down, and you don't move. There is a bra that we have been made aware of by a former patient, and it's called She Fits, and they've got a form here at the office you can ask for if you would like to look into that. We don't get a penny from it. It's been recommended, and she says it's excellent and you don't move. And I've gotten several testimonies on that from different ladies. But don't wear it until you know you're finished here, because you don't want to wear it too soon. In your packet, and this is part of the consent forms that you are going to send back, it is called the after hours phone numbers. You also have a copy that stays in your packet, but there's 2 numbers listed. The top number is the office number answering machine. The second number listed is the answering service, and you talk to a real person if you call that number. Now, I'm going to come back to that in a second. The last single sheet on the right-hand side of your packet is called the financial policy. If you'll go part of the way down that form, it says cancellation. And it specifically says, If you cancel surgery less than 7 business days, Dr. Ed's retains $500. Well, what if it's the morning of surgery, you're supposed to be here at 7 a.m. and you wake up at 3:30 and you are sick, you have 102 temperature? What do? Do not call and leave a message. The front office does not get here at 7 in the morning. They will not have that information, and the nurses back in surgery, they'll have your room ready, and those packs are very expensive, and you would get charged. What you need to do is call the second number. Doesn't matter if it's 3:30 in the morning, someone will answer. You speak to a person, you tell them, I'm supposed to have surgery with Dr. Ed's early this morning. I am sick. They said call them at home as soon as possible. They know when to do that. You will not get charged. That also goes for a family emergency or some crazy weather situation. Just always remember, never assume. Always make the call and call that second number, talk to a person. If it's after surgery, it could be nighttime, but especially Thursday, say 5 or 5:30 until Monday morning, if you call, you're going to get the answering machine. If you need something, you call the second number again. This time you say, I've just had surgery with Dr. Ed's. They said if I need them, call them at home, and they're very good about doing that. So you're always covered. You're never out there by yourself if you need something. And then one other thing I need to address is called revision surgery cost. Now this is down the road. What if it's several months down the road, 6 months, 8 months down the road? You had to go back to the OR for some reason. At that point, still, Dr. Ed's does not charge you his surgery fee, but he does charge for the OR, and he has to pay anesthesia, so that is passed through to you. And that is another thing that we don't do often, but you can never say never about that, and he just wants to make sure you're aware of that. Now, if you're okay with everything that we went over, you will need to just sign and date and send this back with your consent forms. If you are having a breast lift or a mastopexy, then there's a few other points I just want to mention regarding your surgery. First thing is, with a breast lift, you will not use ice or heat. You put nothing on that area. And with a breast lift, you will have stitches. They usually go around the areola, down, and sometimes under. It is still fine to shower the next day. Soap and water can go down over your stitches. Just when you get out of the shower, you pat dry, and then there's an ointment that's checked on your shopping list. Usually it's Baxitracin, unless you have an issue with that. You will just go around the incision or stitches, and then use sterile non-stick gauze up like this. Usually that first week he does not have you to wear the bra. Sometimes he does, so always make sure it's with you, even day of surgery. If you're not in the bra that first week, you will have to use some tape. You can get paper tape or whatever you can get at the pharmacy. If he does put you in the bra, then you can just put the gauze, sterile nonstick gauze, inside the bra, and you can use less tape. But the ointment is only used while you have stitches. And most of your stitches come out at 1 week. At 2 weeks, the remaining stitches are out. So when the stitches are gone, you do not have to use the ointment. At that point, again, it's still a good idea to use a light day panty liner, but instead of using something just under, it would be like an upside down T, and you can just wear that inside the bra. And then the last thing I would mention is, and it would be on your shopping list, for the mastopexy or the lift, that takes longer, so you're back in the OR longer. And it is just a standard of care for you to wear compression hose. And as far as your compression hose, they just need to be thigh length. And on your shopping list, if you just go to Amazon and you type in exactly what's on your shopping list, compression hose, thigh length, several different brands will come up. It doesn't matter the brand. It doesn't matter the color. Some say open toe, closed toe. It doesn't matter. They just need to be thigh length. And usually you can find them for about $23, $24. Bring those with you day of surgery. You will wear them when you get here, and you're going to wear them at least till the next day when we know you're up moving around. Now again, sign and date and send this back with your consent forms. Again, if you have any questions whatsoever, we want you to call the office. This is just going over your nursing care, and it is for educational purposes. And it's been a pleasure talking to you. Thank you.